We told you how American children and teens are experiencing a mental health crisis.
Now new data from the CDC this week shows it is worse for young girls. Arman Rahman broke down the numbers with a local doctor.
Eric and Charlotte, according to the CDC, 57% of female high school students experience persistent feelings of sadness or hopelessness in 2021. That's up from 36% just 10 years ago. Now, behavioral health experts tell me it's important to address this as early as we can because before more start losing interest in activities and develop larger issues.
Our girls are suffering disproportionately.
And recent numbers from the CDC show it. Between 2011 and 2021, high school-aged girls were more likely than others to feel hopeless and twice as likely as boys to consider suicide.
And it can just be self-doubt, or it could be surges of hormones, or it could be confusion about identity and role.
Dr. Matt Dahl, Director of Behavioral Health Services at SSM Health, says social media is a big factor.
There's a lot of sex trafficking. There's a lot of pressure on girls. And without that support to grow and prosper, they oftentimes bear the burden of what we would say is more internalizing disorders, which is anxiety and depression.
But it's not just the screens.
There's been more intense controversy and animosity in the adults of the world.
Dr. Dahl says adults haven't been making the world very safe or inviting.
Which I think really even further makes the complexities of growing up and trying to figure out adolescence many, many folds more challenging.
So what can we do?
Oftentimes adults want to solve the problem, and we really have to listen and validate the experience of the person that's trying to share how they're feeling.
And since teens often feel more comfortable sharing with their peers, it's important to teach them healthy support methods.
Question, persuade, and refer. It's QPR training. And so we've helped school districts in our area roll that out to teens. Are you doing okay? What's going on? So let's refer you to someone that we can find that will help you solve the problem.
And if you or someone you know is struggling with mental health issues or considering suicide, there are resources available to help. Calling 988 nationwide will connect you to the Suicide and Crisis Lifeline.
Arman, thank you.